Good afternoon.
You have reached a COVID-19 call center.
The calls were up to the roof.
Hello, this is Avis with the Houston Health Department.
Pretty much like 500 calls per day.
¿Puedo ayudar con quién hablo, por favor?
Non-stop.
In a busy day, we could receive 7,000 to 8,000 calls.
How may I help you?
The COVID-19 call center, established March 11th, 2020. In the early days of the pandemic, hundreds of new hires were packed into the George R. Brown Convention Center.
Things changed so rapidly. It literally every day we came to work, it was something new.
They had a desk, a computer if they were lucky, and a phone.
Was to get the call center running. So we had little to no training. We were pretty much just put on a desk with a phone and said, answer and help as best as you can.
Good afternoon.
Jalen Taylor was activated early when her before COVID role with the health department's Project Saving Smiles was shut down.
My supervisor asked me, oh, you want to participate in the call center?
She had no idea what that decision would ultimately mean.
So I was like, of course. But at that time, I thought it was just a few days. Oh, people are going to call us. We're going to register them to get tested, and we're going to be done. No, it became a whole list of needs.
Gardenia Santana was also an early addition to the team, armed with few resources and even less actual information on this novel coronavirus.
It was a scary situation and we were scared, but we had to put our own fears and our own problems to the side to focus on the community.
Call center staff stayed on top of the latest recommendations and guidance from the CDC. Communicating that information to every caller was their way to ease the city's fears.
We were getting calls about, if it was safe to drink bleach. We were getting all sorts of questions. There was no questions that weren't, being answered. We were there to educate.
From the start, fighting misinformation and myths, even dangerous untested cures, was a high priority.
People were scared. People were really serious about calling us and asking us, is it okay to do that? They're just trying to do everything to stay alive and to stay safe. You see how that misinformation is actually fatal.
We would just go in, and as soon as we were in, we're already taking calls. There's no time for prep, no time for anything. You just go in there, take calls.
Health Inspector turned COVID call center assistant supervisor Jason Trotter worked the board to keep track of the calls as they came flooding in.
When all the calls were coming in, all of a sudden, it just disappeared. That means that it was so many calls coming in, the circuits were too busy and disconnected all the calls. These people were waiting for all these hours to be reached, and then all of a sudden it just goes away.
Back online, the phones kept ringing.
Once those vaccines came out, our calls went through the roof again.
When we reached capacity, it was really hard because people waited on the calls for 4 to 5 hours to even reach the COVID call center. So when that happened, we usually take their numbers down and make sure the next day we will call them back.
Every call, every person, call center reps did their best to help.
Well, how do we get these people that don't have transportation to go get a COVID test? People who had issues paying their rent and go to work during that time. We've kind of assisted with pretty much everything you can think of during this pandemic.
Even when the voice on the other end of the line was desperate.
Some calls I received were very, very sad. People were crying, said, please, I need to be tested. My family is really sick. And other calls during the vaccine point, I need this or I'm going to die. And that really touched me because at the end of the day, we're really helping the community.
At the end of some very long days, each call was answered.
Make sure that you're actually listening. So part of that is actually taking in some of their emotions.
And another Houstonian helped.
It's good to know that we've helped so many people.
Through testing mania and vaccine hysteria, this team picked each other up.
I understand where you're going through. We're all in this together.
We supported one another and, we pushed through. We definitely were emotionally exhausted, but we knew what was at stake.
Their job wasn't on the front lines, but they fought COVID-19 with their words and their actions to get people tested and vaccinated, protected.
It opened your eyes to be grateful during this time because people lost lives, they lost their livelihood. COVID really changed us all in some shape, form, or fashion.
For HHD, I'm Morgan Nash.